Welcome to this panel on protecting and promoting the health and safety of health and care workers, a conversation between NBC's New Amsterdam, New York University, and the World Health Organization. I'm Nisha Sajnani, founder of the Arts and Health at NYU and director of the NYU program in drama therapy. Once hailed as heroes in the midst of the pandemic, violence against healthcare workers has significantly increased. According to the WHO, up to 38% of health and care workers suffer physical violence at some point in their careers. Many more are threatened or exposed to verbal aggression, and unfortunately, as we've seen in disaster and conflict situations, health workers have become the targets of collective or political violence. Now, the issue of healthcare worker safety was recently amplified by NBC's New Amsterdam, an American medical drama television series. And here to talk about the show and efforts to protect the health and safety of healthcare workers are first David Schulner, the creator and executive producer of New Amsterdam. Schulner started his television career on Ed Zwick and Marshall Herskovit's beloved Once and Again. Additional credits include the award-winning first year of Desperate Housewives, Everwood, Kings, Tell Me You Love Me, Do No Harm, and Emerald City. As a playwright, Schulner's plays have been produced off-Broadway at the Atlantic Theater, the Old Globe, Long Wharf Theater, and at Sundance. Peter Horton serves as executive producer and director on New Amsterdam. Since his breakthrough role as an actor on the hit ABC series 30-something, Horton has established himself as a prolific writer, director, actor, and producer. He was co-creator, executive producer, writer, and director of American Odyssey. He directed the pilot of the long-running Grey's Anatomy, for which he received both an Emmy Award and Directors Guild of America nomination. He also served as executive producer on the critically acclaimed Fox series Lone Star. We're also fortunate to have with us two stars from New Amsterdam, Jocko Sims and Sandra May Frank. Jocko Sims is an actor, writer, producer, and stars as Dr. Floyd Reynolds on New Amsterdam. His numerous additional film and television projects include Dreamgirls, Jarhead, and 2014 summer box office hit, Dawn of the Planet of the Apes. His first series was a lead role in the Starz original series Crash, and for 5 seasons he starred as Lieutenant Carlton Burke in the TNT network hit The Last Ship. Originally from Texas, Sims graduated from UCLA with a BA in theater. Sandra May Frank stars as Dr. Elizabeth Wilder on New Amsterdam. As one of the very few deaf actors in primetime television, Frank has a rare opportunity to showcase her talent in a brilliant way. Frank is a trained stage and film actor who made her mark in Deaf West's Spring Awakening on Broadway. Additional credits include numerous music videos, theater productions, film and television roles, including NBC's Zoe's Extraordinary Playlist and Netflix's Daybreak. She's also the production manager of Deaf Austin Theater, a nonprofit theater company in Austin, Texas. We also have with us two leaders from the World Health Organization, Jim Campbell and Christopher Bailey. Jim Campbell is the director of the Health Workforce Department at the World Health Organization and formerly the executive director of the Global Health Workforce Alliance. His role at WHO includes measuring the impact of COVID-19 on health and care workers, triangulating data from all sources, and he's overseen the development of WHO's Global Health and Care Worker Compact that will be discussed at the World Health Assembly in 2 weeks' time. And last but not least, we have with us Christopher Bailey, who is the Arts and Health Lead for the World Health Organization. Now, I've had the pleasure of collaborating with Chris on the Healing Arts Initiative, which he co-founded and which has had activations in London, Paris, New York, and Houston, with planned activations for Kigali and Riyadh next year. The program builds sustainable arts-based health interventions in communities, focusing especially on underserved populations, as well as building the evidence base to support policy at the national and international level. Bailey was educated at Columbia and Oxford universities, as well as the American Academy of Dramatic Arts. Welcome, all of you. Thank you so much for being here. So my first question is to David and Peter. Now, New Amsterdam has addressed several timely topics, including vaccine distribution, mental health, food insecurity, the health and well-being of Indigenous peoples and asylum seekers, racial disparities, access to affordable care, and inequities in birthing procedures, just to name a few. You've really covered so much, so many timely topics. And most recently, you've taken up the issue of violence against healthcare workers. So could you tell us a bit about why you chose this storyline?
Look, if you read the newspaper once a week, like, these topics are so prevalent, and our job is to tell stories that haven't been told before in the most interesting and entertaining way possible. And Peter can attest on, Grey's Anatomy has been running for 18 years. So a lot of the medical stories that are kind of the staple of these shows have been played many times before, which is a great opportunity for us to tackle issues that haven't been tackled before, and be able to say to NBC and Universal, who might be wary of wading into controversial waters, say, look, we're going to do something that hasn't been done on a primetime medical drama before. And so we get away with telling these stories because no one else is telling them, and they're happening right now. So we get to take advantage of the timeliness. And look, we'd rather not be telling these stories. We'd rather these issues weren't happening. But as long as they are, I feel like Peter does too, that it's our responsibility to tell them.
I think also this issue, more than any of them, is deeply perverse and ironic. That the people who are trying to save us, the people who are putting their lives on the line, sacrificing time with their families, sacrificing safety for their families, are doing so much to try and help us in this pandemic, are the ones who are perversely being targeted for, it's hard to even understand what for. I mean, when you hear the reasons and whatnot, they're all part of this sort of what feels like a mental contagion in our country right now, that's manifesting itself specifically right now as an attack on the people who are trying to help us the most. And I think that in and of itself just requires that it be talked about, that it be brought forward. It's the only thing we can do in our work is just draw attention to issues and try and reveal things about them, and in a way that's emotional, so that people can feel it, as opposed to it being political or being something that's just discussed. And I think being able to bring this one forward and say, look at this, look what's happening here. Do you really, does this feel right? Any sensible person is going to say no to that question. But we have to at least bring it forward, and so people can feel it and address it in one way or the other.
That's really well put. You take very complex issues and you bring them to a human relational level. And, in order to do that, of course, we're relying on the extraordinary talent that you have in this show. And so I'm going to turn my next question over to Sandra and Jocko. Can you tell us a bit of what it was like to prepare for these scenes, and about your own awareness about violence against healthcare workers?
If I may start, I'd say it's interesting, David, you had mentioned opening up the newspaper, and I consider myself a bit of a news junkie, but somehow this issue unfortunately had evaded me. And we have seen over the course of the pandemic a large increase of violence as a whole, violence towards minorities and whatnot. But when I found out that this had been an issue, which is a bit par for the course with the mantras, the anti-science we've been hearing about, and the anti-vax, this sort of falls in line with that. And when I found out about it, I was heartbroken and devastated for obvious reasons. And we have a close relationship with healthcare workers and people on the front lines, and we've done what we can to ensure we're doing our part to helping them and staying in touch with them and understanding what's going on. So myself, I was devastated to discover this, and of course was thrilled that we were able to tell the story in a very entertaining way. You know, you see that we're all in the story, you see that we're all there having a good time, and then things obviously go south, but I thought it was done very well.
I mean, Jocko won't say this, but Jocko's developed, Jocko is delivering pizzas to emergency rooms during the height of COVID. Jocko has really put himself out there as a support system for frontline workers, including the frontline workers who work on New Amsterdam, who are still working at Bellevue and Kings County and other hospitals. So Jocko, more than anyone, has been very, I think, personally affected by these people that he's been supporting for the last 2 years emotionally with pizza.
Bravo.
I think we all need to be supported emotionally with pizza. I'll pass it to you, Sandra.
I'm with Jocko on this. When I actually first read the script and what's going to be happening in New Amsterdam and with what my character is going to be facing, I had a discussion with Connor Marks, and he plays Wilder's interpreter. And we were talking about what was happening during the pandemic, and all the healthcare workers and everybody within the medical care system, they were all protesting and marching, and people were saying, even though you disagree with what we're doing, and we're still here advocating for your lives and still here trying to protect you, yet people still came at them, ridiculed them and criticized them, spreading messages saying to stop saying fake news. And when that really started to come out, as a deaf and hard of hearing person within the community, even though not the specific words in the message were coming out, the facial expression and the body languages were very critical, and was readable. And then with a delay, we finally got access to the captions and the actual messaging that was happening. And it was shocking, because the bottom line is health is health. It doesn't matter the politics to it. It's just about saving each other's lives. Doctors are humans themselves. As they're trying to save others, they're sacrificing their own lives to be doing this. They are taking time out of their family, out of their passions to come in and support people, even when the people are against what they're doing and not believing what's happening within the pandemic. And so I am just so grateful for New Amsterdam creating this episode. It's not easy, and I knew that there was a potential for people to also criticize the episode itself, but it's just such a beautiful storyline, and there's a lot happening. It's a lot of exposure. It raises more awareness, and it's a true storyline. These are actually happening within the country. So it's a critical message to share.
Thank you for that. And, both of you have referenced, we've just been touching a bit on the pandemic, and of course the COVID-19 pandemic highlighted the extraordinary work performed by health and care workers under very demanding conditions. And this has drawn attention to the need for a continued focus on their occupational health and safety. So I'm going to pass this to Jim now to tell us a bit about the scope of the problem as you see it with regards to violence against health and care workers, and what the WHO is doing in response.
Thank you very much, Nisha, and great to be amongst the esteemed panel here. And see you in real life compared to the TV screen. Obviously, since the start of the pandemic, we've had a standardized measurement and reporting framework of the impact of COVID on health and care workers. We're looking across many, many domains: the infections in the workplace, the deaths amongst health and care workers. We believe over 115,000 have died in the last 2.5 years. Through this workplace infection. We're looking at strikes and labor protests, but also this issue about violence and harassment in the workplace. And then there's two elements here in violence. There's the violence in everyday situations, and there's the attacks on healthcare, what we're seeing in Ukraine, what we're seeing in Yemen, Syria, Afghanistan, and many other examples. But on this violence in the workplace, in the context of the United States, you say you've been reading the newspapers there. What's the evidence? What's the data? Nisha, one of your colleagues at New York University, Timothy Dye, published one of the earliest assessments of this. We've seen health and care workers 50% more likely to have suffered violence, harassment, and abuse than any other sector in terms of the impact of this, mainly fueled by, the fake news, vaccine, infodemic challenges. The president of the American Medical Association is on record saying, imagine 5 times more likely for physicians to be abused in the workplace than any other sector. The American Nurse Association has come out with data saying at least 1 in 4 are experiencing violence. These numbers are an exponential increase than we would normally increase. This burden is very, very real, in addition to the stress, the anxiety, the burnout that they're facing from 2.5 years of the service delivery, the impact of the infection. What are we doing? The second part of the question, working with colleagues around the world. Last year at the World Health Assembly 2021 was designated the International Year of Health and Care Workers by all 197 governments that participate in WHO, and a celebration of their work at the forefront of the response. And yet we see this violence also happening in the workplace. We had a decision, a resolution in the Assembly around protecting, safeguarding, and investing in the workforce with clear recommendations for what governments and employers need to be doing. From that, you mentioned in the introduction, the Global Health and Care Worker Compact. We've been working with Georgetown University, Professor Larry Gostin, one of the world's most senior experts on global health law, to develop what is the single reference document to the obligations, the responsibilities from states, from employers to protect health and care workers in their workplace environment. That document will be considered by ministers of health, or equivalent to your Secretary of State, Javier Becerra in the US, will be considered by the ministers from around the world in 2 weeks' time, and will be an opportunity to drive that further forward. But it's not just in here. The House of Representatives in the US has passed a bill, an act, to make it a requirement for all employers, public and private, to put in place workplace safety to overcome this increase in burden. I think it's absolutely fantastic that the medical dramas in the US, NBC, are fully behind this very real problem and actually giving it some dramatic interpretation to make an impact.
Thank you, Jim. Chris, I'd like to turn it to you now. As the arts and health lead, you've been invested in how the arts, including storytelling and television and film, offer a vital medium for health promotion and treatment. But could you tell us a bit of your experience concerning violence against health and care workers, and your thoughts around this intersection of arts and health in this context?
Well, thanks, Nisha. I think they are connected. I think we're often under the assumption in public health at WHO that if we can compile the evidence and encourage better decision-making, our job is over. But in point of fact, particularly during crises, during epidemics, simply presenting the facts to the public is not often enough. Because you have the fear reaction. When people are scared, when people are confused, their judgment center literally is dulled, and people make mistakes, and people can find themselves in violent situations. As an example, when I was in West Africa in the 2014 Ebola epidemic, I was with a body retrieval team with the Red Cross in Liberia, in Monrovia, the capital. And on this particular day that I'm describing, we were in the Montserrat slum, and there had been reported a young woman who was 26, had been 6 months pregnant, and she had died presumably of Ebola. And when the team made our way through the warren of these improvised streets in this shanty town, we arrived at this hut, and inside was the woman who was deceased. And the only other object in the room was this charcoal clay pot. That's how poverty stricken this area was. And our job was to negotiate with her older sister for the release of the body for proper taking care of the body. And as we were negotiating, the neighbors began to gather around, first 2, then 3, then 4, and pretty soon there were over 100 people encircling us. And we had all heard stories of violence against healthcare workers during the Ebola epidemic, and we were very aware of the risk, and we had been trained. But when you face it, it's another matter. Because as we began to explain the reasons why it was important to retrieve the body and have a proper processing of the body, the anger began to grow and became palpable. And at one point, the older sisters asked, "What are you going to do with the body?" And we said, according to the Liberian policy at the time, we're going to cremate it. Now, in Liberian culture, cremation is not part of the cultural tradition. It was considered an abomination. And so the gasp of horror of the crowd was absolutely chilling. And we knew that we were facing a situation that was like an emotionally super saturated solution. All it took was one rock and it could have had a very tragic ending. And then at that point, we said, "What was her name?" And the sister said, "Excuse me?" And we said, "What was her name?" Her name was Aisha. What was she like? And the sister began to describe who she was, what her aspirations in her life was, what the aspirations for her unborn child was. And soon the neighbors began to chime in, and the anger and the tension evaporated like a mist. The reason why this story is important is that oftentimes just mere recitation of facts and figures are not enough to gain trust over a community. You have to treat people like people. You have to hear the stories. You have to listen. You have to connect. And that's what shows like New Amsterdam do. They humanize the situation. You begin to triangulate emotionally to it and connect to it. And it's literally a different part of the brain. And that's why I think many of us at WHO would like to commend the show for the work that you do, not just the writers and the producers for the storylines, but the actors themselves to connect with each other in such a profound way that allows us to explore these issues in a way that is not didactic, but authentic. And let's take the situation of this plot line. It would have been easy to totally demonize the bartender who spiked the drinks. But even in that small role, the writing and the actor portrayed him as a real human being who had real issues. Now, violence against health workers is an outrage. I'm not covering over that basic fact, but it was a human being that did that and a human reaction. And that to me is the beauty of what you guys do day in and day out.
Thank you for that, Chris. Now, we've had some wonderful perspectives shared here for us to continue the conversation. And we have a question from our in-studio, in-Zoom audience already. This question comes from Catherine, who asks, how can highly visible people like actors and producers move forward the protection agenda? And connected to that, who can carry the message that attacking health workers means less access, longer wait times, more opportunities for viruses and disease to flourish? In a way, Chris, you've spoken to this a little bit, but I'd love to open this up to the panel for your comments and thoughts on this question.
I guess I have question to that question for Jim, which is, you talked about the legislation being passed or trying to be passed. I know when you attack a police officer, it's a bigger crime than attacking a citizen. Can violence against healthcare workers be held in the same kind of rubric as attacking a police officer or a politician? Like, can we protect them more?
I think, David, I mean, there has been this historic social contract that has been there, that our health workers are protecting us, and we have to protect them. They are, one of the most trusted professions in the world, nurses and physicians, and every family knows a nurse or a physician, even if it's only your local specialist at the end of your block. What we're seeing over the last decade is an erosion of that social protection, that social contract. And indeed, whether it's in conflict environments or in the US or any other jurisdiction, how do we get that back? I mean, legislation, I think this issue that Chris was talking about, how do you build trust in a community to extend those protections, that they go beyond information sources and our immediate responses of anger and violence or whatever it may be. The US House of Representatives Act, which is particular to workplace, does oblige employers and the state, the US government, to put in place those mechanisms. But I really think it's a much more personal issue about our social contract and our social appreciation.
I think one of the things that we can do is what we're doing now, because we fulfill very different functions, and we have very different tools in our tool belt between us on the side of telling drama, telling stories, television, and people like Jim and Chris who are actually out there doing it. I mean, often I say, try and describe the distinction as they're the people out there actually gardening, and we're back there telling stories about gardening. We're not out there getting our hands dirty, but both are really important, and working together like we're doing here, where we can take what they're doing and describe it with our best tool, which is an emotional tool, which is, letting people feel the inside of the work they're doing, not just have the facts and figures of it. That partnership, I think, is pretty effective in terms of having some sort of, at least hopefully having some sort of impact on the insanity of this situation, because it truly is an ethical perversion that's out there. And we like to think that if we can describe it well enough and together, that it can have an impact on that, because it hopefully at the heart of everybody is a reasonable being.
Another question from our audience, from Allison. You've touched on this somewhat, but how has your perspective on the pandemic and the health system more broadly changed due to your involvement in the show? Jocko or Sandra, would you like to speak to that?
Sure. It's definitely it's opened my eyes to a lot of things naturally, all of our eyes. It's affected me firsthand in that the approach that I take with getting my mother care, for example. We've touched on the disparities and the mortality rates with African Americans and African American women, unfortunately, that we see in healthcare. So, in this year, my mom's had some issues, some ailments. She's had a tumor that she had to be removed from her head, and she's doing well now. But she carried this for a couple of years. Apparently, she'd gone to a neurologist who dismissed her symptoms, said that everything's fine. And, at that point, I started to think about some of these things, some of these issues that we've covered on our show. And I'm like, well, what if things aren't quite fine? Let's get a second opinion and a third opinion. And we did over the course of 2 years until finally this tumor was discovered and it had to be removed. And then there was a hurdle of, you know, she's in the county healthcare system in LA, and I'm on the phone with some of these doctors and some of the workers, and they're expressing to us that because she's in the county system, this is an emergency, but she doesn't have any emergency symptoms, so there's a chance she can get bumped. So it was quite difficult, but had it not been for my experience on the show and all of the stories we've read and come across, and it suddenly became very real, I'm not sure how much of the due diligence that was necessary to get it done. We would have really gone through to get it done, you know. So I'm very thankful for that and for that experience. Yeah.
Plus, you were able, given your training on New Amsterdam, to go in and actually help with the operation.
Thank God thank God I did not have to.
Part of what happens on this show, you know?
Yeah. Yeah.
You know, really my involvement in being in the New Amsterdam and being able to witness this change, especially as a deaf person from my lens, and with everybody wearing the masks and throughout the pandemic, the first year was extremely challenging. And of course, everybody is impacted in various different ways, but as a person who's so reliant on facial expressions, mouth shapes, everything really did exemplify the challenges of communicating, because not only were all hearing people that we were interacting with wearing masks, but our interpreters were as well. And so it really took patience to remind ourselves everybody is human, and being able to kind of be a little bit more performative with our signs until we were able to get access to clear masks that were see-through and transparent masks. But the big gain has been that medical centers now have been providing clear and transparent masks, which is a significant impact and an improvement just for the long run. And being able to navigate better through the healthcare center, any of the services, to ensure that if there's something that you notice going on with your body, and being able to advocate for yourself because you know yourself the best. And that is so critical as a gain. And then considering, you know, as a deaf patient going into any medical facility, seeing a deaf doctor on the screen and imagining my experience going to a hospital or some type of facility and being able to sign directly with my doctor is incredible. And it's also caused me to look into myself and see, with this platform that I have and this opportunity and the role that I have, what can I do to really advocate for people? Because it's such a critical platform that can be used. And if we can all work together as human beings, supporting each other, really acknowledging the needs that need to be done, and just connect with each other at the end of the day, you know, slowly and surely we certainly can get by.
Thank you so much for those perspectives. I want to turn to another question now that's connected to what you just shared, Sandra, with regards to just this piece around accessibility with one's own physician, you know, being able to communicate in a way that feels right and appropriate to who you are and, you know, to the context that you're in. And this question actually comes from a colleague of mine, Jeremy Segal, excuse me, who's the Assistant Vice President and System Chief Wellness Officer in the Office of Quality and Safety for all of New York City's health and hospitals. And he asked this question: in an ideal state, what would workforce wellness look like for healthcare workers? And what would you want all healthcare leaders to know about wellness at work? And I'm just going to add one more piece to that, which is specifically for Jim with regards to what healthcare safety and protections mean, because I think accessibility is part of what you've been discussing vis-a-vis that compact that you were telling us about. So in an ideal state, what does healthcare workforce wellness look like? What do you want leaders to know?
Excellent question from that. Obviously, the whole concept of well-being is at the heart of WHO's constitution from 1948. It's the the mental, physical, mental and social well-being for all people. And talking to both Sandra and Jocko, their observations, for every human being, it's a fundamental right for every human being, irrespective and without any discrimination for race, religion, political, social, economic, or the ability to pay. And so the same principle then for the workers that we rely upon, that their physical, mental, and well-being is a core part of this. We have seen, I mentioned earlier, we've been measuring the levels of anxiety, stress, and burnout in the health and care workforce, and the figures are very, very concerning in just about every jurisdiction and every systematic review and paper we look at. We're asking these people, the emotional anxiety they went through in the first 6 months, fearing for their own lives, not having protective equipment, not being able to go home and hug their family members. They're being without, living in hospitals, living in healthcare facilities, so they don't infect their own families. As the pandemic changed and we got better, so that reduced, but still overload and stress. The protections for health and care workers in many resolutions of the World Health Assembly, in the Constitution for the WHO, really, and yet alone the employers' responsibilities, every health and care worker should have occupational health and safety protection and support for their well-being when needed. That said, a key point here is that we need health systems to really deal with. We shouldn't put the focus on whether a health worker has stress and anxiety as a weakness. If you were in their shoes at this moment in time, how would you cope? Where you weren't provided that enabling environment, you weren't provided the tools to do your job. As a physician, as a surgeon, you start to take the tools away. It's extremely, extremely difficult. So there is, if we want them to be responsible for their clinical practice, for their medical practice, we have to be responsible for their health and well-being at the same time.
Thank you for that. Would anybody else like to comment on what wellness looks like for health and care workers?
Well, I think from my perspective, as Jim was alluding to, it's more than just the absence of the negative aspects. It's not just not being stressed. It's being able to do your job, to thrive, to be a full person, and I think that's key to WHO's conception of health. And what's important about that too is that, as Jim was saying, it is for everybody. The chain of human health is only as strong as its weakest link. And I think that was one of the major lessons of the pandemic, that none of us are safe until all of us are safe. None of us can thrive until all of us can thrive. And that, I think, is a very powerful lesson for us as individuals in our communities, but also as a message to our leaders.
I'm taking notes because this is the story that New Amsterdam is working on now. About Max is basically saying gathers all the doctors under false pretenses and says basically, you're going to focus on you today. Like, what have you been putting off medically? What are the things that in your life are preventing you from giving the best care to your patients? So I'm taking notes, Chris. The chain of human health is something great for Max to say.
We steal from the best. That's our motto.
I'll bill you later.
Organization. Chris, you also talk about that health is not the absence of sickness. Can you? What's that quote that's so good?
Well, that actually goes back to the WHO definition of health in our Constitution, where health is not the absence of illness or infirmity, but attaining the highest level of physical, mental, and social well-being. I'm paraphrasing slightly due to middle age, but that's the gist of it.
We can give you the verbatim, David, if you need it.
Perfect.
It's effectively that.
But the other thing that I really loved about the 2-episode arc, and in a way it's emblematic of the narrative strategy of all of New Amsterdam, the whole run of the show, is crime is committed in the first part of this 2-episode arc, and nobody knows. Everyone is having a good time at the karaoke dance. We get to see the character of Elizabeth do that wonderful ASL karaoke, which I thought was absolutely wonderful. And over the course of the 2 episodes, it slowly is revealed that something is terribly wrong and there's a pattern and they have to figure it out. And that's actually the way public health works. When something goes wrong, an epidemic happens or a situation emerges, we often have very little information at first. And when the clues begin to happen, we have to put it together like a puzzle. And so much of the issues that you deal with on the show are hiding in plain sight in most people's minds. And so to create a narrative where that gets revealed, where people can perceive what's happening and why, is not only a powerful narrative tool, but it's very authentic to how we deal with life.
Thank you. I'm going to be listening for where this line might show up in the next few episodes in your next season. But I wanted to come back to something that was stated earlier, which is this tension between self-care and social care, or individual care and collective care. And as many of you have already spoken to, certainly our interdependence has been amplified. It's been really lifted up as a key value that we need to protect and promote. And it's a muscle that we really need to develop further to get through the next crisis and the next one after that. And you've spoken to this, Jim, that it requires an enabling environment. Chris, you spoke to the presence of what is needed rather than only what is absent. And so I wonder, going forward, as we are in an endemic phase, yet there is turbulence all around us in the world. I wonder if we could close with a question around where you see this work going for you individually, where you see it going creatively. And I know that, David, you already spoke to this a little bit. And politically, Jim, as you're deeply engaged in the policy side of this. So taking this work forward, that's my question for all of you as we bring this panel to a close.
Wow. Wow. I mean, sadly, there's a lot more to do. And so part of it is just diligence and persistence. Or as Chief Dan George once said, endeavoring to persevere. It's these issues, as you said, Nisha, are not just health issues. They're political issues. They're sociological issues. They're everywhere. And there seems to be just a kind of dark mist all over the world right now in terms of all of these issues. And I think our job as storytellers is to constantly try and shine light in it, try and get back to a fundamental, essential truth. And when it comes to healthcare workers, for example, it's such an obvious truth that most of the work is done by that. The fact that the motivation of healthcare workers is to help us, is to save us at their own peril and risk. So the more we can just keep shining light on that over and over and over again, I think light is the best antidote to the darkness. And the more we can illuminate it, the more we can stay the course with it, I think the more impact and effect it will have. At least I hope so.
I think it's also a great question overall, seeing as, for example, with our show, it will come to an end at some point. And how, I don't know what type of show we'd all be involved in next, but how to keep that going. And for me, I felt that being on New Amsterdam and being a part of New Amsterdam and being able to tell these stories and read these stories and watch these stories has enriched me so much more as a human being, particularly being on it during a pandemic. And I feel like I will be a lifelong advocate for healthcare, and for frontline workers, and just have to be creative in finding ways to keep that moving forward, and using our voices. But I think it's a great question, seeing as again, at some point soon our show will come to an end. So how do we keep that going?
Yes, I really think it's important to keep the dialogue. And it's so exciting to see people communicating, whether they agree or disagree, but they're able to continue instead of this idea of just, it was 2 years and the pandemic's done, so let's move on with our lives. I think it's important to maintain the gifts that we did actually acquire during the pandemic and dialogue and communicate with each other, create stories out of this. Whether the dialogue is positive or negative, it doesn't really matter, because it's just that we can be connecting with each other and we can encourage more dialogue, more communication, and really talking about things, even if the topics are not comfortable.
Let me jump in, if I may, to the specific point on some of the policy issues. I mean, just in today's conversation, we've been talking about inequalities. Inequalities, amongst family members, inequalities in the access to healthcare. The United States is a particular model of care services and how you access that, but there's inequalities all over the world. The opportunity that we have coming out of the COVID-19 pandemic, and it's not yet over, we still haven't beaten this disease. There is still a challenge that we have to address. But the opportunity is we've got an audience of people who are engaged in personal experiences of dealing with the pandemic, dealing with the issues, and how do we communicate with them? As Chris said, we can do our technical work, we can bring evidence, we can bring empirical studies, we can make policy recommendations, but we need people to actually make the behavioral change, whether that's people in communities, people in government, people all over the world, families, carers, to make that change. And they don't necessarily watch the WHO ministers of health having a debate for 6 hours on the solutions. They're going to watch, medical shows, the sound bites from news. So how do we connect with people? And that's the value of putting policy together with practice and behavioral change. And let's keep on going. And Jocko, Sandra, we'd love to have you back and working with WHO and being the champions for some of these health and care worker issues and health systems issues and access to care issues and the inequalities. We need your voice.
Well, and just to second that, Jim, for me, one of the most striking images of the episode and maybe the series as a whole was just simply watching Sandra's character, Elizabeth, walking down the street in her scrubs, being proud of being a medical professional, that the response to violence is not to hide or be ashamed or to cower or even to be violent back necessarily, but to do your job as fully as possible. And to me, what was ringing through my mind was Leonard Bernstein's quote on how to respond to violence, when he said, "This will be our reply to violence, to make music more intensely, more beautifully, more devotedly than ever before."
Mm-hmm.
And that's what you do.
That's what all of you do. This conversation has really highlighted the interdependence between art and policy as well. Interdependence between art and public health, public policy, that we need each other in order to move us towards the change that we all seek. I want to thank all of you for your insightful and inspiring remarks, your perspectives. I want to thank our in-studio, in-Zoom audience for your wonderful questions and participation. And for those interested in catching up on New Amsterdam, of course, you can catch up and stream the full series on Peacock. So thank you, everyone.
Oh,
Sandra.
I just want to add one thing really quickly. I just remembered something that I really, really want to share. So what I've been doing after working in New Amsterdam is there's this one street that I walk on just as myself, as Sandra. And anytime if I pass by a nurse or a medical care service provider, I always just say thank you to them. And, you know, it catches them off guard. But just seeing any medical professional in their gear and just passing by them and just simply saying thank you. You know, some people aren't sure what they do. They just pass by, but what a great thing you can do by just saying thank you. It's just one last thing I wanted to share with you, but I think it's an important sentiment.
And one last thing I'd like to share is if anyone is interested in learning more about arts and health and you're in the New York City area, on June 11th at 6 p.m. at Lincoln Center, Nisha and I will be having an event on the subject, and please do come, it's free.
Does anybody else have one more thing?
There's always one more thing.
I'm going to second Sandra's idea. That's a brilliant idea. I love it.
Thank you for that, Sandra, and thank you, Chris. And I think I was just moved by the poetic quote you offered, and it brought me to that ending sort of space. But thank you, everyone, for speaking to what comes next, the future. And we wish everybody here good health, happiness, wellness, and safety, and look forward to being in conversation again. Be well.